Michael Sigmon, and I'm going to talk to you today about the legalization of medical marijuana. I want to talk to you about natural remedies. Have you ever been nauseous? I think that we all will admit that it's a horrible feeling. Did you know that these items could help that feeling? According to Discovery Channel Fit Health Division, rosemary improves poor food absorption and peppermint treats. Rosemary improves poor food absorption and peppermint treats irritable bowel syndrome. Persuasive overcomes nausea from chemotherapy or radiation treatment, even when conventional anti-nausea drugs have little effect. Lemongrass is used in Brazil and the Caribbean, and in most of the Southeast Asia to relieve nervous digestion. This soothing massage oil can help cure some of the aches and cramps associated with an upset stomach. I do not think any of you will argue that these three remedies are all the things that we would not hesitate to consume, whether it was to help us with nausea or just to add delicious flavors to our food. Let's move our discussion to a topic that is a little more conversational but nonetheless important as we look at natural remedies for health-related issues. The topic is the use of marijuana for medical purposes, or the medical use of marijuana. Let's start by looking at the symptoms for which marijuana is recommended. There are pain, spasticity, sleep disorders, nausea, vomiting, or loss of appetite. Now let's look at marijuana, the herb. The organization procon.org is dedicated to educating us about the positive aspects of the use of marijuana. This chart of information can be found on their website. Let's start by looking at some of the ways the chemicals from the plant can be given to patients. Butter or cooking oil could be used in marijuana. The cannabis flower tops and leaves are simmered in butter or vegetable oil for several hours, transferring the THC and other cannabinoids to the butter. The solid plant material is then discarded. The butter, now a dark shade of green, is then used in baking such items as brownies, cakes, or added to such foods as spaghetti sauce or soup. The oily base of the butter is needed for the cannabis to properly adhere. You can also use marijuana as an oil. This can be used for most symptoms for which cannabis is recommended, and the patient can choose whether to inhale for quick relief or add to liquids or foods for different results. You can also use cannabis for tinctures and tonics. This can be used for most symptoms for which cannabis is recommended, and the patient can choose whether adding to liquid or food or under tonic. You can also use a vaporizer. This is a non-smoking method, most often recommended as an alternative smoking. Patients can utilize it for most of the symptoms/conditions for which marijuana is recommended. As you can see, we are not just talking about smoking marijuana. Look at the options. Ingesting food that has butter or oil with cannabinoids on it. Other forms that allow inhalation of the medicine given gives patients options just like they have with other medications. I know when I got a little older and I was sick and I needed prescribed medicine, my parents would ask me if I wanted a pill or a liquid version. You know, when I think about marijuana in this way as a real medicine, not just something you use to get high, I really wonder why it is not legal to use as medicine. Now let's look at a resource that is considered much more acceptable because of its role in the scientific community, the New England Journal of Medicine. In the article, Medical Use of Marijuana, polling results published on May 30th, 76% of all votes were in favor of the use of medical marijuana purposes. Even the journal says they were surprised. The way the journal works is to propose a scenario and then ask the doctor to respond. They present the case of Marilyn, a 60-year-old woman with metastatic breast cancer. We asked whether she should be prescribed marijuana to help elevate her symptoms, to evaluate her symptoms, to frame this issue. They invited experts to present opposing viewpoints about the medical use of marijuana. J. Michael Bostwick, MD, a professor of psychiatry at Mayo Clinic, proposes the use of marijuana only when conserving options have failed for fully informed patients treated in ongoing therapeutic relations. Gary M. Rossfield, MD, from the University of Florida, certified in anthology and pain medicine, and Robert L. Depute, MD, a clinical professor of psychiatry at Georgetown Medical School, provides a counterpoint concluding that there is little scientific bias for physicians to endorse smoke marijuana as a chemical therapy, as a medical therapy. There were 1,446 votes were cast as 72 countries and 56 states and provinces in North America. The biggest majority of votes, 1,063, came from the United States, Canada, and Mexico. Each state and province with at least 10 patients casting votes have more than 50% support for medical marijuana except Utah. In Utah, only 1% of 76 voters supported medical marijuana. Pennsylvania represented the opposite extreme, with 96 of 107 votes in support of medical